In this holiday episode of the ASC Podcast with John Goehle, we check in on the latest news in the ASC industry, talk about the possible exposure of 3,700 patients to bloodborne pathogens at an ASC in New Jersey, discuss recent pharmacy issues, talk about an update on radiation requirements and ASC radiology surveys in New York, and a focus on performing an annual review of your quality improvement program.
Welcome to the ASC Podcast with John Goehle, a bi-weekly podcast for anyone interested in the freestanding ambulatory surgery industry. This episode is sponsored by Ambulatory Healthcare Strategies. The ASC regulatory environment is increasingly challenging, but organizations that outsource their regulatory oversight to ambulatory healthcare strategies have an edge. AHS works with ASCs to oversee their quality improvement, risk management, emergency and infection control programs, run their meetings, develop education programs, and always be prepared for surveys. Welcome to episode 44 of the ASC Podcast with John Goehle for Thursday, December 27th, 2018. We are recording from our studios in Rochester, New York. This is Sue Cronkite, Senior Nurse Consultant with AHS, and I'm here with John Goehle. John is one of the leading experts in all aspects of the freestanding ambulatory surgery industry, and he is the author of over 10 books about the ASC industry. John is a nationally known speaker and the owner of Ambulatory Healthcare Strategies.
So, Merry Christmas to our audience out there. I hope everybody is enjoying the holidays.
Yep.
Right now, we certainly are. We are recording during our holiday break.
Happy holidays, everybody.
That's right. It's been an interesting Christmas, hasn't it?
Yes, it's been busy.
So you still haven't seen your grandchildren because they're quarantined.
Yeah, my older grandson started kindergarten this year, and he's been sick like almost nonstop. And then his little brother gets sick, and then his mom, my daughter, gets sick. Yeah. I'm just waiting for him to get better and we can celebrate together.
I know. So we've at least, we've celebrated with your family with my family and part of your family.
Mm-hmm.
But,
yep. My mom.
And I guess we should talk a little bit about our annual Ambulatory Healthcare Strategies Christmas party and retreat, which was a lot of fun, but it was, what would you call it?
A little crazy, a lot of pandemonium happening. We had...
The dogs outnumbered the people.
4 or 5, yes.
Yes, I think at one point. So we're dog people in this company. As a matter of fact, we did hire a new person this last week, so we're staffing up again, and we kind of told him half-heartedly that he needs to get a dog because he's
and
a cat
I'm okay
person.
if he does. I think we have enough dogs at our meetings. So it's okay.
So what I'm doing, Sue, is I am actually doing some outtakes from our shows over the past year. Mm-hmm. For our 50th podcast, which is coming up. So we'll make sure we include some of the outtakes that have pretty much all been because of the dogs walking around or
okay.
commenting on
some. So I'll go in. I do the editing, so I think I'm going to have to go in and I may erase a few things, but we'll keep yours in and all the dogs.
One of the things we did discuss during our annual retreat, well, we actually do 2 retreats a year, but in December in our retreat, we always kind of look at the various programs that we recommend for our clients, and we made some pretty significant changes to the quality assurance and performance improvement program this last year. So we're going to talk a little bit about some of the things that surveyors are looking for a little bit later here. So hopefully that'll be a benefit for our listeners.
Yep.
And so, Sue, why don't you start by talking a little bit about what's going on in the industry?
Okay, well, I wanted to mention first, there's still time to register for ASCA's 2019 Winter Seminar. This year's program is taking place January 17th through 19th in Austin, Texas, and it features 3 specialized tracks. There's ASC Management Essentials, which is new this year.
Right.
Coding Update and Reimbursement Strategies. And the third is Infection Prevention Techniques for ASCs.
Well, actually, all three of our nurses are going to be there, working pretty much in the infection control area, because I know everybody's...
But I wondered if we wanted to spread it around a little bit, and you did say, we could. You don't have to stick to one track.
Right, exactly.
You can move between them and go to any of the sessions that that you're interested in.
And we should note that Lori Rodricks, our new CAPE certified individual, infection preventionist, she's just passed the certified ambulatory infection prevention test, and she's now newly CAPE certified, so she'll be at the conference also. So definitely, if you attend, and I hope you will, you'll stop by and say hi to any of us from Ambulatory Healthcare Strategies, and certainly from this podcast. If you want more information about the ASCA 2019 Winter Seminar in Austin, Texas, go to the ASC Association website at ascassociation.org. So I think the biggest news that came out since our last podcast was what happened in a New Jersey surgery center.
Yeah.
I guess a New Jersey Department of Health investigation determined that the ASC staff didn't follow appropriate sterilization procedures.
Yep, the center notified 3,778 patients by mail. These are patients who had undergone surgery at the center from January 1st to September 7th of 2018. They were notified that they may have been exposed to bloodborne pathogens and recommended that they undergo testing for hepatitis B, hepatitis C, and HIV. That's pretty scary news. So the surgery center will have to pay for all that testing. There were no actual infections or illnesses that have been reported yet, but that's not a letter you want to send out to people.
No, and I think it does highlight some pretty important things here. First of all, the center was closed for almost a full month, most of the month of September. They had to hire new staff. They provided new training on infection prevention. They upgraded their infection control practices. I can't imagine the amount of money that they've had to spend to get this up and running.
Well, just a horrible publicity.
Publicity, right. Everybody knows about it. We're not going to mention their name here, but definitely it's not the type of thing you don't want your name in the news as a result of that. And infection prevention, infection control, we talk about it all the time on this podcast. We have 3 nurses on our staff, yourself included, who really dedicate quite a bit of their time to infection prevention and education, and you're our go-to people when we try to figure out what needs to be done in the infection control area. But every single surgery center we have has an issue in some way with infection prevention. Maybe they have it under control, but they have things that they have to watch for that are unique to their particular organization. And it's important that you keep on top of it. And this center clearly had some significant issues. The Department of Health came in and they identified those. And basically, I'm assuming they kind of told them they had to shut down until those issues were taken care of. And people lost their job as a result of this. So if you didn't take infection prevention seriously before you heard about this report, hopefully you will now. So.
And the Joint Commission sent out a Sentinel event alert called Developing a Reporting Culture, Learning from Close Calls and Hazardous Conditions. So this was, you actually found it and sent it over to me, and this was a really interesting read.
It is, and this is one of my passions. I as you know, Sue, I spent 5 years with the American Red Cross in disaster services. And a big part of disaster service, we were first responders in the event of a national or a local disaster, but most of the time we spent on training and preparing for these things. And after some type of a disaster, the first thing we would do is we would do a debrief and we would learn from it. And every debrief identified issues that could result in some changes. And that's what's going on here. We never looked at these things as failures. And same thing in the surgery center. Just because, a bad event happens, you try to learn from it rather than try to hide it.
It's also a lot about the close calls.
Right.
Which we've talked about in the past, good catch, close
near
calls.
misses,
That kind of thing, because they're really stressing finding these things before they happen. So they just went a little bit more in depth. They talked about establishing trust, not fear, as your leadership. It started me thinking about when I was in nursing school, there was a clinical instructor who everybody was really terrified of. And I think she just wanted everybody to do everything right under her supervision, but people were so afraid of her. They were afraid to ask questions. They were afraid to tell her if they thought they might have made a mistake. And I don't think anything actually happened bad, but I always thought if anything was going to happen, it was going to be under her supervision, because people just didn't feel comfortable going to her. So I think, building that trust. So if people come to leadership and say there's been an issue, don't let punishment be the first thing that comes out of it, but also
Or trying to find blame.
Yeah.
I think that seems to be the result of a lot of these quality improvement programs, unfortunately, is that when something goes wrong, you try to figure out who to blame for it, and then you move on. And that, my experience with the hospitals has always been that's their primary culture. And I hoped when I got into the ASC industry that, we would make a change. And I think we have.
That is changing.
Yeah.
And also, though, I think when people bring up concerns, sometimes, even if it is a near miss or just something they're thinking could happen, you'll often get other people, more senior nurses or just more experienced people saying, well, that's just a standard of care. That's just something we know, and then people are afraid to bring things up. So I think anything that's brought up, you can assume if this one person notices or is confused about an issue,
right,
it could be across the board. And so I think just being open to that, not making anybody feel foolish or feel that they've done something wrong. So when the Joint Commission investigating harmful events, often the leadership demonstrates a lack of response to staff concerns. They find as they're looking back, or they're just they don't take it seriously. More of a no harm, no foul type of an attitude.
Yeah.
That they don't really look at it until the really serious things happen. So, like we were saying, the good catch programs are becoming more common.
And a good catch program would be something where you would encourage people to bring things forward and actually reward them
as a rewarding thing. Right. Yep, have some type of a reward program or recognition. Yep. And they did mention, though, important to close that feedback loop. If some changes are made, then let the person know who reported. Let them see the good that's coming from that. As we know, anytime we're doing quality improvement, that we have to close that loop. Right. And another point they made is one of the reasons to get the good catch and the near misses is you get a lot more information. So you can track and trend those things and you can see where the issues are. If the only things you're tracking are the actual bad events, you're hopefully not going to have many of those. Right. So you're not going to be able to really do a lot of tracking and trending with that. So
I love that phrase. So one of the things they brought up during in the alert was change progresses at the speed of trust.
Yeah, I know.
That's great. I love it.
Yeah, I like that. And they have a lot of examples. One of the things that's kind of scary, they said a new nurse it was probably in a hospital, put a yellow wristband on a patient because where she used to work, this signified that the arm wasn't to be used to draw blood. They had an injury on the arm or whatever. And in her current workplace, that meant the patient was DNR. The patient had a heart attack and was almost not resuscitated because everybody saw the yellow band. Somebody luckily recognized that and the patient was rescued. But that led to Pennsylvania having a standardized system for color-coded wristbands. And I guess 41 other states do now, as well as the military. So, that was a really positive change. And as always, include everybody that can be involved in the process, holding the managers and the leadership responsible and recognizing them when improvements are noted. Encourage the people that bring up the concerns or just anybody that's actually hands-on and doing whatever it is that people are concerned about. Encourage them to come up with solutions, try out those solutions, and really be involved in that process.
I'm going to provide a link to the alert, and the article actually had some educational videos in there and also the 4 E's of a reporting culture, which is establish trust, encourage reporting, eliminate fear of punishment, and examine errors, close calls, and hazardous conditions. And that can be printed and distributed or posted in your facility. So that's our news and kind of scan of the literature. Let's just talk a little bit about some of the observations we've had in the last couple of weeks since our last podcast. So we had an interesting event. I was out shopping for Christmas Eve and get a phone call from one of our centers that they had a drug delivery that was stolen on them. So we've all been hearing in the news reports of people having their packages stolen from their front porch or after a UPS or a FedEx delivery person had happened, and that's what happened in the center. This is an organization that's co-located in a residential building. There are 2 separate entrances, one for the residential, one for the businesses, but it appears the delivery driver delivered the drugs to the residential building. They were non-opioid and non-Schedule I drugs, but they were immediately apparently stolen. Luckily, there was a recording done of this, and I guess the gentleman who stole this...
he returned.
He returned again to do it again. Not terribly smart guy, but he's in police custody now. They have not, at least not as of a couple days ago, actually got the drugs back, but that's kind of irrelevant at this point.
Yeah. But we wanted to talk about what to do in that case, because that's kind of a panic moment when that happens.
Right. Well, the first thing I always tell is, of course, do an incident report on it. And then we talked about what happened. By the time they got a hold of me at the grocery store, they had actually done most of this. They contacted the vendor, who immediately started to replace the drugs, contacted the shipper to tell them that they need to be careful about where they place the drugs and when they deliver them, and also to make sure that they get the drugs signed for. And a couple more things that are going to come out of that incident report is probably putting up signs in the residential area to remind delivery people to deliver packages to the surgery center, to the separate entrance, and to request a signature upon delivery. And of course, don't deliver if no one is there. This is getting pretty bad. I know that a lot of videos up on YouTube of people stealing, boxes. So,
especially with medications, I would think you'd have to have a signature.
Well, I think if it was a Schedule 1 or an opioid drug, I think there would have been a different situation, but certainly not in this case. So. And then we also had an interesting discussion about succinylcholine in the last month. This is from our friends George Scoris. He's over at ASC Pharmacy Solutions, and Laura, one of his pharmacists there. So there's been a question from some of our clients about what to do when succinylcholine has been removed from the refrigerator. Laura told us that as soon as succinylcholine is removed from the refrigerator, it begins the deterioration process. So you have to date it at that point. So if it's in the refrigerator, as long as it's refrigerated, the expiration date is appropriate. But as soon as it's removed from the refrigerator...
Yeah, whether it's opened or not.
Correct.
It's pulled out of the refrigerator.
Correct. Whether the top has been taken off or not, whether it's even been used, obviously, the deterioration process has begun, and you have to date it and dispose of it within 4 weeks. So this is kind of big news for everybody. I don't know that everybody knew this. Certainly there's been a lot of questions about it, so I thought we would pass that on to our listeners. And while we're talking about succinylcholine, which we know can result in malignant hypothermia, we thought we would just talk a little bit about malignant hypothermia for a second here. Remember that if you have any of the agents known to activate malignant hypothermia, or MH, you need to have an MH protocol and rescue drugs such as dantrolene on hand. So MHAUS, which is at mhaus.org, the Organization for Malignant Hypothermia of the U.S., has a list on their website of the various triggers for malignant hypothermia. And
I do think it's important to mention, too, because we've had centers that they say, well, they don't really use these medications, but they might have them in stock just in case. If you have them in stock, you have to have the reversal agent.
That is absolutely correct. As long as you have this drug maintained in the center, even if you have signs that say don't use it, you're going to have a malignant hypothermia protocol. So these are the things that MHAUS tells us we need to watch out for. We all know inhaled general anesthetics, desflurane, enflurane, ether, halothane, isoflurane,
methoxyflurane,
sevoflurane, and of course succinylcholine. Now, we had an interesting question this last week. Somebody asked us whether rocurium was on the list of MHAUS, and it turns out it is not. It's not a known agent, but there has been some scientific literature. I was proud of myself. I actually did some research, Sue. You're the research expert, but you were making Christmas dinner, I think. And so the American Journal of Health System Pharmacy on July 1st, 2012, had a case where they indicated it might have been, the conclusion was that it was delayed onset MH as a result of administering the rocuronium. So, I think the important thing is to be very careful of this drug. We found a situation recently where we had some in one of our centers. When our pharmacy consultant, when Laura looked at it, she says, why do you have this here? You would never have a need for it.
Yeah.
And apparently it had been ordered by a previous anesthesiologist. It was never going to be used at the center. So she recommended that the drug be removed. So here's the takeaway, of course. There's always a big takeaway from something like this, is that you need to make sure that you're looking at your formulary periodically. Updating the formulary based upon the drugs that you're actually using and that you actually need. Talk to the anesthesiologist. Make sure that the list is complete and that there isn't anything in there that you don't need, and that everything that you do need is on that list. And just keep it up to date, which is going to be, and this annual review of things, of course, is going to be the topic of our next segment here. We're going to talk a little bit about what's going on with the annual review of quality improvement. So let's take a break and we'll come back and talk about quality improvement program annual reviews.
As we talked about with our Christmas work party, we discussed some of the things we were going to change and improve going into the new year, and we always recommend that our centers do that as well.
You didn't make our work party sound like a lot of fun.
Well, it was fun too. We also had lots of good food that
That's right.
everybody made. And
But yeah, so annually it's a good time, just like we have New Year's resolutions, annually you probably should sit down and look at various programs that you have. Not only should you, you have to. It's
Yes.
part of the requirements. So let's talk about one of those programs that's most important that you review on an annual basis, and that's the Quality Assessment and Performance Improvement Program, better known as the QAPI program. So let's just remind our listeners of the regulatory authority for this and the CMS conditions for coverage, and that's 416.43E. And this is where the governing body has a responsibility to ensure that the organization has a quality assurance and performance improvement program, and that it's defined, implemented, and maintained by the ASC, that addresses the ASC priorities, and that all improvements are evaluated for effectiveness. And the implication there is that it's done on an annual basis. That it specifies data collection methods, frequency, and details. It clearly establishes its expectations for safety, and it adequately allocates sufficient time, information systems, and training to implement the QAPI program, which, by the way, is probably one of the bigger issues there is, making sure that they set aside staff to be able to do this. And I think that's one of the issues. That's one of the reasons that companies like Ambulatory Healthcare Strategies, sponsor this program, and the company you and I work for,
Yep.
Exist, is because what we're finding is that nurses often just don't have the time to do that. And while they obviously have responsibilities in that area, companies like AHS, can help reduce the amount of time. That's right. So, and the survey procedures in the interpretive guidelines for the conditions for coverage for ASCs 416.43E has a list of things that surveyors would be looking for. So I just want to go down that list. So these are the questions that a surveyor would be asking a surgery center. Does the ASC's quality assurance and performance improvement program include all of the essential elements that we talked about earlier here? Ask the ASC's leadership to explain how the governing body is involved in the QAPI program. Does the ASC's leadership display ready knowledge of the program's structure and activities? If a contractor is used for some portions of the program, such as AHS, does the ASC's leadership monitor closely the activities of that contractor? Is there an evidence of a governing body review of all elements of the quality assurance program? For example, the meeting minutes. We need to stress again how important minutes are for demonstrating what's going on in a quality improvement program. I went to, we might have mentioned this in an earlier episode, but, brand new client of ours just came up about 3 or 4 weeks ago. I went in to do an annual report for them. They hire us to do an annual report. And I asked them if I could see copies of their minutes, and they said they don't have any. They haven't had any for a couple of years. And I kind of spent a good hour there explaining the importance of that, and they hired us immediately to help them get caught up on that. So that, again, if you don't have meeting minutes to demonstrate your quality improvement program exists and that you're monitoring things, you better have a really good explanation as to how you're monitoring quality improvement in your organization.
Yeah, you just have to have a way of proving that you're doing it. I think it kind of gives you that structure to know where you're going with it, keeping track of positive changes, what you need to focus on. That's
by doing a meeting, you mean? Yes. I agree.
Yep.
The other things that the surveyors will be asking, ask the ASC's leadership how it uses the program to improve performance. Ask for evidence of changes made as a result of the quality assurance program activities. And to this point, I still remember a surveyor asking me a question in my early years in the industry, which then I started to do every time I did a survey. And he very simply just said, okay, give me a specific example of something that happened that resulted in change and how you dealt with it in the quality assurance program, the medical executive committee, and the governing body. And so I always made sure after that I had specific examples anytime we had a survey to show them of that. Not just something minor, but, obviously one of the more significant things that we did as a result of that program.
And that's more reason why you want to really make sure you notice incidents or problems as you're tracking things, because you always want to show that you're improving things.
Right. And I guess it's a good time to mention again that if the only incidents you ever report are bad ones, that doesn't look good for you. So when you have a good program where you have incidents, you're identifying incidents and they're relatively minor, but you take them seriously because you want to make sure that you're improving even the most minor issues.
Yep.
When a surveyor comes in and sees that, they're going to believe you when you tell them that you haven't had any incidents in the past year. And then the last question the surveyors would ask for this section is ask the ASC's leadership for documentation of the details of the resources that are dedicated to the quality assurance program. Is there evidence that these resources were actually made available as planned? For example, interview staff identified as having a role in the QAPI program to determine whether they actually perform those functions and for what percentage of their time. Is there evidence that planned data collections and analysis actually took place? So again, surveyors are always going to be looking for this information when they come in looking for a center. Accreditation organizations actually have a lot more specificity with regard to this. So, for example, 888C requires you on at least an annual basis to have the governing body review various aspects, including the quality of care in the organization and the effectiveness of the quality management and improvement program. So let's delve into 41643 A through D to talk a little bit about what they're expecting to see in that quality assurance program. And then I'm going to end this segment talking a little bit about some of the changes that we're making to our program as a result of some observations we had this last year. So we know that the ASC must develop an ongoing data-driven quality assessment and performance improvement program, and that program needs to be ongoing. Ongoing meaning that it's continuing, that you're not just doing it in that last year prior to the survey, and that those things are gathered on a regular basis, usually quarterly, sometimes monthly. Now, I want to make an observation here too. We've walked into centers that, because of their volume, have felt that it was important that they have monthly meetings. And I have yet to actually see even a large organization that can't make do with a quarterly meeting. I know there's a lot of data to go through in that time frame, but that just makes it even more important that you have somebody summarizing that information, graphing that information, doing really nice charts and summarizing those things at a high level. I'm not saying that you shouldn't have quality improvement meetings monthly if you have a need for them, but don't do it just because you're, such a high volume. I found that many centers, most centers can make do with a quarterly meeting. Now, the next section talks about program scope. So this is 41343A, and the program must include but must not be limited to an ongoing program that demonstrates measurable improvement in patient health outcomes and improves patient safety by using quality indicators or performance measures associated with improved health outcomes and by the identification and reduction of medical errors. So what they're talking about here is we all have standard quality indicators like infections, transfers, et cetera. But they also want to make sure that those quality indicators are specific to your industry. So if you're an eye surgery center, for example, one of those measures should be the number of unplanned anterior vitrectomies. If you're a GI center, then you're going to want to track the number of perforations you have, et cetera. So for each of the industries and for each of the specialties, you're going to have some type of measures indicated in your program scope. You need to specifically outline them. You need to specifically track them and trend them over time, and show data that indicates that you're identifying problems before they become much more serious. And 41643C says that you need to set priorities for performance improvement activities. And this is where we start to get into that annual review section here. You need to focus on high risk, high volume, and problem prone areas. Of course, the only way you're going to figure out if they're high risk or problem prone is if you look to see how frequently it has occurred in the past, either through a literature search for your industry or for, what's happened in your own organization. Consider the incidence, prevalence, and severity of problems in those areas and what the effect is going to be on the patient safety and the quality of care. 41643B talks about the importance of the ASC using data collected to monitor the effectiveness and the safety of its services and the quality of care and identify opportunities that could lead to improvements and changes in patient care. What you're really saying here is, as we've talked about before, close the loop. Once you've identified an issue, make sure that you identify what you've done to fix it and move on. We cannot stress again how important it is that every organization identify a problem. You might think you're the most perfect organization in the world, but there's always things that we can do to improve. No surveyor is going to believe you when you say, nope, we're absolutely perfect. We don't have to make any changes at all. That's going to be a real red flag for them. And I think this goes without saying, but 41643C says performance improvement activities must track adverse patient events, examine their causes, implement improvements, and ensure that improvements are sustained over time. Make sure that you put preventive strategies throughout the organization that target adverse events and ensure that all staff are familiar with these strategies. So as we were just talking about, those things would be similar to, those things that are near misses as well as those things that actually occurred. So what do you do for your annual review? So on an annual basis, you should look back over the past year and look at the results of your organization. If you've had no incidents over the past year, I would actually probably say that your program is probably substandard. What it means is that nobody is out there tracking information. Nobody is keeping on top of events, or you're not really trying to improve quality. You're just trying to maintain quality. Mm-hmm. So if you've had no incidents in the last year, and I'm your surveyor, watch out, because we're going to indicate that there's some type of an issue with your program.
We want you to look a little bit deeper.
That's right. Actually, and that's a very good point, Sue, is that every time you should be looking at these things and saying, okay, I haven't found anything over the past month. What can I do to look for even more events? Mm-hmm. How much deeper can I get? Some people laugh at me when I say, well, okay, then just write down every time the piece of equipment broke down. If you have nothing else going on, because, if you track and trend that type of information, you might start to realize, well, maybe my maintenance program isn't working well. Maybe I'm buying equipment that's substandard. Maybe my people are not maintaining that equipment right. There's always so much you can learn from any of these things. Yeah. So let's just talk a little bit about some of the things we're focusing on this year in our quality improvement programs, just from observations over the last year. So we actually had one of our centers in New York State that had a New York State inspection for radiology. And we really rarely get involved in this, actually, but the center asked us if we could help them to prepare for that survey. And in the process, we brought our expert on radiation safety, and that would be Judy D'Ambrosio, who is a former host of the show, out. And she spent a couple days with that center, getting them ready, making sure that all their daily logs were up to date, their annual inspections were done, and that the quarterly badge reports on the radiation were up to date. And, they were in good shape in general, but I think what we learned from that is that perhaps as part of our quality improvement programs, we should be looking at them and making sure we report in the quality improvement meetings that we've reviewed the daily logs, that they're up to date, that we reviewed the annual inspections, which I think we do anyway, and that we're keeping track of the badges, and that those reports that need to be written to employees periodically about the findings from the quarterly badge reports are done. Temperature and humidity, still a big issue. Humidity issues are a big hot topic right now with surveyors. So we have that right in our minutes. We have been experimenting with that over the past couple of years. Now there's a specific section for it. So we're actually reporting situations in which the temperature and humidity are outside of the range. Another issue, I think we've talked about this in a couple episodes back, is the quality and controls for waived testing oversight, making sure that on a quarterly basis, we're reporting to the Quality Improvement Committee that all of those QCs are up to date and that they're being performed for any of the waived testing. And Sue, I don't know if you were out on that site, but I've had 2 issues in the last couple months where our centers were not doing the proper QC for their wave testing because they didn't realize that when they bought a new product, they needed to do a different type of QC.
Yeah. Always staying with what the manufacturer recommends.
And again, you really don't take these things for granted. I mean, those decisions as to what products you're buying are probably being made at a level that is much lower than the supervision. So, getting out of our offices every once in a while and walking around and checking on these things is definitely a good thing. Yeah. We are now, another thing that we've changed is that fire and disaster drills are actually indicated in the quality improvement minutes, the results of those, and if the disaster drills resulted in some changes, which they really should, that we outline any of those changes that are being made in our programs. And lastly, risk assessments are a big hot topic now. There are 3 main risk assessments that need to be done on an annual basis: the NFPA 99, the infection control risk assessment, and the hazard vulnerability analysis. So we're making sure that the results of those annual reviews are reported directly in the Quality Improvement Committee meeting, and we're actually attaching those risk assessments to the minutes of those meetings. So hopefully that gives everybody a good overview of what you should be looking for in your quality improvement program, and kind of gives you some encouragement to go back and revise your program. I just want to end this by saying that it's not a problem to write in the minutes of your governing body that you need to make changes to your quality improvement program. I think people, are not necessarily wanting to do that because it kind of indicates, well, we weren't doing things right. But when I read that in the minutes of a governing body, I know that they're taking it seriously, that they said, whoops, maybe we need more resources there. Maybe we need to train the people there a little bit more. Maybe we need to make some changes because they're not specific enough. Maybe the minutes are not detailed enough. Maybe our meetings aren't long enough. Whatever things that you might observe about the quality improvement program, admit to it in the governing body, then make those changes, and you're actually probably going to get rewarded for identifying it it and acting on it before a surveyor came out.
Yeah, exactly.
It's always better to identify a problem before the surveyor identifies it. So let's take a break and we'll come back and we'll talk about some upcoming events.
John, you've written a number of popular books about the ASC industry. Can you tell us about them?
Sure. So the two that are in publication right now, which are most popular, is the ASC Survey Guide, which is a guide to the ambulatory surgery center conditions for coverage and interpretive guidelines. And it basically, it's very, very long, but it's a nicely indexed book that provides all the regulations applicable for Medicare certified surgery centers in the United States, with the interpretive guidelines nicely referenced so that you can find the interpretive guidelines that apply to the specific regulations, as well as any of the additional information that's provided by CMS for each of those regulations. And the second book is the ASC Governance book, which is a great book for either governing body members or owners of surgery centers or the administrators who like to know what the surgery center owners need to be doing. It's nice and short because it's written largely for doctors who have short attention spans. Just kidding. But anyway, it's a good book to understand what responsibility you take on when you join the governing body of an organization. So,
okay. And how does someone get these books?
So please visit reg-books.com. That's regbooks.com, regbooks.com. And you can purchase both of those books at that website. You can also get a special offer if you purchase a book through the website for a one-day consultation with me for $19.95, which includes a tour of your facility, review of your quality assurance program, governing body meetings, look at the sample of medical records, credential charts and employee charts, scan of the policy manual, kind of review, quick overview of the life safety stuff. And it includes a very comprehensive debriefing afterwards, a full day on site with you. I love doing these things. It's great to get out and talk to people. Most of the time, people are really grateful. Actually, all the time, people are very grateful for this service. And at $19.95, you can't get a better deal. You can also buy the books on Amazon or most online book websites.
So let's talk about some upcoming events in the ASC industry.
So every episode will inform you of upcoming events, and if you'd like your event to be included in the podcast, please send the event information to info@ascpodcast.com.
The 2019 ASCA Winter Seminars, as we mentioned earlier, are January 17th through 19th in Austin, Texas, at the Hilton Austin. The 2019 conference will include the 3 tracks, ASC Management Essentials, Coding Update and Reimbursement Strategies, and Infection Prevention Techniques in ASCs.
The next Certified Ambulatory Infection Preventionist Program, or CAPE, exam is scheduled for March 1st through 31st, 2019 at testing sites throughout the United States, and the electronic application must be submitted between January 1st and 31st, 2019, so that's coming up very soon. For more information, please visit the aboutcaip.org website. That's about.caip.org.
The next Certified Ambulatory Surgery Center Administrator, or CASC exam, is scheduled for May 1st through 31st, 2019, at testing sites throughout the United States. Electronic application must be submitted between March 1st through 31st, 2019. For more information, please visit aboutcasc.org. That's aboutcasc.org.
And ASCA 2019 will be at the Gaylord Opryland Resort and Convention Center in Nashville, Tennessee. It's going to be May 15th through the 18th, 2019. It's a wonderful site if anybody has ever been to at the Opryland. And, of course, it's a great conference. Virtually all of us from the company will be there. We've got to leave somebody at home. I don't know. Somebody's going to get the short straw there. But we're going to have a lot of fun there, and hopefully we'll be doing a podcast from there.
The Association for Professionals in Infection Control and Epidemiology Incorporated, or APIC as we know it, their 46th annual conference is June 12th through 14th, 2019 in Philadelphia, Pennsylvania.
And the Arizona Ambulatory Surgery Center Association annual conference is June 27th through the 28th, 2019 at the Camelback Inn and Spa in Scottsdale, Arizona. Well, that's it for this episode of the ASC Podcast with John Goehle. Join us again in a few weeks, and please spread the word about our podcast with your friends and colleagues, and do us the honor of hitting the subscribe button.
This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all the rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development, all rights reserved. We would like to thank this week's sponsors. First, Ambulatory Healthcare Strategies, one of the nation's leading regulatory compliance and financial oversight firms. For a free consultation, contact John Goehle today at 585-594-1167 or through email at info@ah-strategies.com. And Eden Group Development, which publishes ASC Regulatory Compliance Series, the ASC Industry's leading books including the Survey Guide for ASCs, a guide to the CMS Conditions for Coverage and Interpretive Guidelines for Ambulatory Surgery Centers, and Ambulatory Surgery Center Governance, a guide for ambulatory surgery center owners and governing body members. These must-have books are available on Amazon and Barnes & Noble or directly from the publisher at reg-books.com. That's reg-books.com. If you're interested in advertising or sponsoring the ASC podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.